Almost every day I am asked, what's the difference between LASIK and PRK? Well, fundamentally, we're reshaping the cornea to correct nearsightedness, farsightedness, and astigmatism. And we can do that on the surface of the cornea, which is PRK, or we can do it under a very thin flap, which is LASIK. The treatment is the same, whether it's done with PRK or LASIK. It's the same laser. The laser is programmed in essentially the same way. The advantage of LASIK is quicker recovery because that very thin flap of tissue goes over the treated area and it heals up overnight. The advantage of PRK is there's no flap. And without a flap, there are zero flap-related issues. Although making a flap is very reliable, very reproducible, rarely there can be a problem with it, whether somebody rubs their eye and they get a wrinkle, or maybe there's a little bit of debris that gets under the flap, or rarely there may be an imperfect flap, which might prevent the LASIK procedure from being performed. In that case, the patient would need to return for PRK. Many patients who are involved in certain activities where they might experience some trauma to the eye may prefer to undergo PRK. And we may recommend PRK for certain patients. For example, if their cornea is thin or the shape of the cornea is not appropriate for laser vision correction done with LASIK. Both LASIK and PRK provide equivalent visual results. But in some cases, LASIK may be preferred by patients because of the faster recovery. In other cases, PRK may be the preferred choice because it is a safer option. As part of the preoperative evaluation of each patient, we'll determine whether laser vision correction should be done as a LASIK procedure or PRK, or whether both are options. The patient can make their own decision. So, whichever technique is used, our patients generally are very happy with their vision afterward. In some cases, neither LASIK nor PRK may be an appropriate choice. And as part of the pre-op evaluation, we'll determine that as well.